Our session is going to be Maternal Health Reimagined, and the New York City Healthcare Innovation Week reflections on innovation and equity. And before I jump into the session, I would love for Helene and Roshane to just give a quick, sort of background on your bio and the work that you're doing at BirthVue.
Sure. Can you hear me?
We can hear you.
Hi, so I'm Roshane Sasson, founder and CEO of BirthVue. I have a background of computer science at Penn State, and I started this company after post-COVID, couldn't really find a footing in anywhere. And through working with OB at Hershey Medical Center, I really was drawn into this solution of helping moms with contractions, with their timing, and was able to create a predictive algorithm that now moms are able to use to help identify their future contractions, timing of active labor, giving themselves the best outcomes. And so far, I've been able to build that company up, form clinical partnerships with hospitals, OBs, as well as just bring a great team together, including Helene.
Great, and I'm Helene Rutledge, and I was delighted to join Roshane as a co-founder and president and COO. And I have a background in the healthcare industry. I had senior global roles in companies like Pfizer and GSK, but then I founded Mend and Upgrade, two other startup companies in the digital health space, and actually, taking some coursework at Columbia Business School Digital Health, which really got me involved in this community. And what's so exciting about BirthVue is that with Roshane's algorithm and predicting labor risks, we're building a device-agnostic remote monitoring platform, and it's going to support OBs and ultimately high-risk patients. So we're really, focusing on that data aspect. And our mission is to prevent avoidable complications and empower both providers and patients through earlier, equitable insights.
Wonderful. Well, welcome again. And so to kick off, I know you shared a little bit, Roshane, about what BirthVue is, but let's get a slightly bigger picture. What really inspired the founding of BirthVue?
Yeah, absolutely. So I would say what really inspired it were personal experiences. We all know the effects that resources can have on outcomes, but seeing the effects of timing, seeing my relatives going into labor and not really understanding, what their immediate next steps were. And for a moment like that, you could only imagine the thoughts that are going through your loved one's mind. So that's really what got me in touch with the understanding of this is a pivotal moment in time. And while working with this OB and just recognizing that underserved communities, minorities were 2 to 3 times more likely to die in a situation where we're in America, like Stan mentioned, we spend some of the most money in healthcare, and yet these outcomes are so negative. And just to hear statistics saying, 60-70% of these complications are avoidable just makes you wonder, how are we okay with this solution? How are we okay with this inequity that's going on, where it's big, it's loud, it's screaming, saying this is a problem, but no one's really focused on it. So that really was a driving impact.
Yeah, well, the personal passion is so important, and I agree with you. It is unacceptable, but it takes innovators like you to really move the needle. So, congratulations and kudos to all the work that you and Helene have been doing on this. You both attended and presented at the New York City Health Innovation Week Innovators event about a month ago, I guess beginning of the month here. And we actually had a chance to catch up a little bit. I certainly had a great experience and enjoyed a lot of the conversations and the topics, but would love to get your perspective on key takeaways as it related to topics around maternal health in the innovation space.
Sure, yeah. So it was really clear from the conference that maternal health is just underfunded and under-innovated. And in fact, the panel that I spoke on addressed the need to look to other sources, particularly as many federal grants have been frozen, and really pushing towards community-based resources. And that like focusing locally allows you to really understand the needs of a particular community, and not subject to as many fluctuations as the federal situation. Another theme was that it's a public health emergency what's going on, and tech alone
Mhm.
can't fix it, because social determinants of health, as you talked about in the previous session, like housing, transportation, all of these things must be integrated into the care models. And it starts with really listening to the patients to be able to meet them where they are and see what their needs are. And even though a lot of these solutions are digital, there is a digital divide. So as we design systems, we have to think about, can we put this on the lowest level of smartphone? Does the person even have a smartphone? Do they have enough, bandwidth for the solution you're designing? So the call to action really that I heard was that you have to center the birthing people in the design, especially the ones who aren't heard. Because if you're designing for, the mass of people who can afford solutions, you're excluding those who can't.
100%. And I really appreciate the reinforcement of the listening. This is a theme that we've heard earlier in some of our other conversations as it relates to, if to be successful as a startup, to be successful as an intervention, you've got to listen first and design for the true pain point of the person who's dealing with it. So clearly it's being pulled through in the work that you're doing. Can you talk a little bit about, how the BirthVue platform is, supporting some of the, how you're able to engage with the communities through your platform, and to help address some of these maybe disparities or inequities?
Yeah, great question. So overall, we're engaging with these communities because we understand that equity isn't an afterthought. First of all, it's a foundational aspect of what we're building. And we understand the impact of working alongside moms and those from historically underserved communities. So what we've been doing is making sure that we're co-creating this product with them, with their input and with their voices, because all of us grew up in different circumstances and situations, but really being able to understand that there are 10, 20, 30 different positions a pregnant mom could be placed in, just from location, from resources that we may never understand and go through. So we're really trying to design it with them, have OBs and a full doula community as a part of it as well, and just ensuring that the small things are managed, whether it's language, having English, Spanish, of various Asian languages on it, having usability, as Helene mentioned, where various versions of the platform can be accessible. Are we creating a solution that could only be ran on the latest iPhone versus one that is 10 generations back? So we're taking all of this into consideration, especially the patients and the moms, because their voices are ultimately going to shape how our product looks, feels, and functions as well.
Well, your passion for that human-centric design and that co-creation are coming through loud and clear. I think it's fantastic, and it's creating, I think, a lot of momentum for the success that you're having. How has the innovation community supported your growth as you've been continuing to build on that momentum?
So I'll start with the great story of how Roshane and I met, because we actually met through the HITLAB ecosystem. Actually, Stan Kachnowski introduced us. And so we met at the first summit. And ever since then, we've been making more and more valuable connections. We connected with Carmen Minsal from the Mount Sinai DIH at another one of the summits. And that led to us winning the pitch competition there and engaging in their incubator. And that led to us getting a signed letter of support from Dr. Mohammed Ghaffar, who is the chair of OBGYN at New York Health and Hospitals. So all of these connections are really, fueling our momentum and, having us be right in that community where we need to be, working with the people that we're looking to design for. And we're currently beta testing with moms and getting great feedback after our first BirthVue baby was born, as you know. But we're looking to do some testing in the Bronx, which I'm a native New Yorker, grew up in the Bronx. So I'm like so excited to be in the community working and, just seeing this getting in the hands of more and more moms. We have some video lately. It's just so exciting to see people reacting to the product.
Well, it's great to see, the innovation community as well as the patient community coming together to be a part of your platform. And also that, as a shout out to the HITLAB network. I mean, we are here to create those networks and those connections. And I think it's a real success story across the board. So, really happy to be, supporting you as well through the work that we're doing here and to see your continued success. We're just about out of time, but as we close out, what role does cross-sector collaboration play in building equitable maternal health?
Yes, another important question, and it plays a very important role. As we see that equity in maternal health can't be achieved in silos, we can't do it alone, and tech certainly can't do it alone. We need collaboration across all fields to actually get a product like this in place and to drive equity. We need the OBs spreading word and awareness and getting their patients connected to innovation. And we need policy leaders. This is very important to help create a path towards Medicaid adoption where doctors could feel comfortable getting this product out to moms, and a wide variety of moms can get access to this because of insurance coverage. And so we're just creating solutions that are clinically sound and culturally relevant, accessible, and scalable. And this isn't just an equity mission statement. It's building a structure that we can actually see measurable outcomes from.
Yeah, agree. I think that's fantastic. And I do know that there are so many in our community and listening today that care about equity in health, especially in the maternal health space. Before we sign off, any final thoughts or messages to those that are a part of our audience today?
Yeah, I think most importantly, we continue to look for those connections. So we're looking for investors. We are currently fundraising, OBs and doulas, and you can reach out to us through our LinkedIn profiles or also info@birthvue.com. We have an exciting event that's coming up in July, so I'm going to have Roshane announce that one.
Well, yes, as well. So we recently were selected to attend this year's 2025 Essence Festival of Culture. So, we were invited to New Orleans, just being a part of a cultural program that is now focusing very heavily on healthcare and innovation, being selected to really present BirthVue on this global level that can see over a few million in viewership. So really understanding the impact that although we're just getting started, although we are, looking for fundraising, we're not looking for interest. We're not looking for pilots. We have that sectioned off. We have OBs across a few states that are interested in piloting. And we're, like Helene mentioned, we're getting these letters of support. So we're just kind of using that to move forward, really garner traction and understand that moms and importantly as well, doctors are seeing the value of this product. So just trying to accelerate and get it to them as soon as possible.
That's fantastic. And congratulations on that. And I think to all those listening in the investor space or the partnership space, now's an opportunity to be reaching out. You're going to be going on that global stage very soon. So congratulations on all your success. I know I've had the pleasure of watching you the last few years, and you've really been tremendous. And it's all coming from the heart. And I think that's really the key. So thank you for all you're doing. Continued success, and we'll be watching. And please reach out to Roshane and Helene if you're interested. So thanks a lot. Great to see you guys.
Thanks,
Thank you so much, Amy and
Take care. Bye.
Stan. Take care.